Dateline Premium. Subscribe now on Apple Podcasts.
We are back with alarming new data that shows eating disorders among America's youth are more severe than ever before.
Yeah, troubling stuff here. We saw hospitalizations for eating disorders spike during the pandemic, but experts say eating disorders among teens remain at an all-time high, even though we've returned to in-person school, sports, and social activities.
Dr. Kelli Rugless, Project HEAL CCO and a certified eating disorder specialist, joins us now with more on this. Hi, Dr. Rugless. I'm so happy we are having this conversation. I just did a report recently also on boys and men with eating disorders, something that we don't talk about nearly enough. Let's start this off by taking a closer look at some numbers specifically. So according to a recent report from the data company Trilliant Health, eating disorder-related health visits, I mean, look at this number on your screen, up 107% between 2018 and 2022 for those younger than 17. What do you think is behind this dramatic increase? Why is this happening?
I know, those are really heartbreaking numbers. I think there's a variety of factors that are behind the increase. The main one being, we can't ignore the pandemic and the impact that it had on the social lives of teenagers at a really critical point. And we also have to acknowledge that anxiety and depression were already risk factors for eating disorders. So when you take something like the pandemic that exacerbates anxiety and depression, it's going to make that incidence even higher. And we also, the other thing to think about is that in 2013, the diagnostic criteria for eating disorders was actually expanded to be able to actually include more people who were suffering. So that's also something to consider as we think about why these numbers have increased. Yes, eating disorders as a whole have increased, but we've also been able to diagnose more people effectively.
Well, that is good news. The more people can be diagnosed, more people can be treated. Something I don't think is talked enough about is the symptoms that parents it can actually watch out for. Do we know what you can tell parents? What should they be looking for their kids?
Yeah, I think parents should really look for marked changes in how their children relate to food. So a kid who used to love coming down for mom's home cooked meal is now bringing their own food to dinner or refusing to eat altogether, or their favorites are no longer acceptable because they're trying to get healthier, they're trying to get, eat a little bit cleaner, a little less junk food. Some of these things can sound really harmless in the beginning, but most eating disorders are harmless at the start. No teenager expects or wants to trigger an eating disorder, but they might have different risk factors that they're unaware of that make them more susceptible. So any big change in their food or how they move their body should be a really big sign for parents.
The other thing that we should talk about here is treatment and how it can be approached in a variety of different ways, because one of the things that I found in my reporting anyway is how difficult this can be to get treated, how difficult it is to get insurance to cover it. Another big problem, there are serious wait lists for a lot of these facilities that are specifically focused on treating eating disorders. What is available in the meantime, and also minority groups or people whose insurance isn't going to cover this? What options are available?
So there are a lot of options. Like you said, there are eating disorder treatment centers that, provide really great care, but there are barriers like insurance companies and long wait lists. To address those barriers, there are nonprofits like Project HEAL that offer a variety of different services to help people get eating disorder treatment. So there's insurance navigation programs where somebody will help you talk to your insurance to see what they cover and to try and push them to cover things that they should cover. There are cash assistance programs where, at Project HEAL, we will actually help people pay for the cost of their eating disorder treatment. And then there are, individual providers that specialize in eating disorder treatment where while you wait, you can work with an individual dietitian, an individual therapist or physician to help sort of keep you in check before you can get the treatment that you need.
And Doctor, we don't have a lot of time left here, but wanted to ask, before we can even get to treatment, how do parents even approach talking to their children about this? It can be difficult for them to even find a way to bring it up.
Absolutely. Gently is the best advice that I can give. Parents, don't be afraid to talk to your children about some changes that you're noticing, but also understand that one of the issues is that it's hard for teenagers to even see that it's happening when it's happening. So be gentle, be loving, but make sure that you talk to them about the changes that you're noticing and your concerns.
Absolutely. And I would just say one more plug for it. It can also happen to your boys. That was one of the most startling things that I learned, that I think a lot of parents, it got to a really bad point because they didn't even recognize that that's something that could happen to their son. Dr. Kelli Rugless, thank you so much. A really important conversation.
Thanks for having me.
Well, the Smithsonian's National Museum of African American History and Culture